Hi everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome to a slightly different video today. This is an update video, which I rarely do, but this patient is the same patient as on the last video. So within the space of, 2.5 weeks, the ear canals have filled again with dead skin. So if you watch the previous video, the case history to this particular person is that I've seen him a number of times within very short periods, 2 to 3 weeks, and every time I see him, I suction out basically, moist dead skin from the ear canals. There's no pain, but just intense itching, no vertigo, there's obviously hearing loss, a little bit of tinnitus, but the patient is in no huge discomfort. It's just really annoying because the ears are just consistently, time and time again, filling up very rapidly with dead skin. So it's a very unusual condition. And this is the follow-up. So again, this is, one of many times I've seen him already. And I thought I would do an update video because many of you have asked for an update because it is such an interesting case. And here it is, once again. The ear is, completely clogged up. This is him, I think this is his left ear. Both ears look the same, but I'm only showing you one ear here. No, maybe this is the right ear actually. And as you can see, pale, not really sluffy, but pale, moist, dead skin, essentially. It's kind of got the consistency of cottage cheese, essentially. So the update is, well, there's not really an update. He's still waiting for an ear, nose and throat consultant to see. He's not had any communication yet from the ENT department. That's not overly surprising at the moment. So in the UK, it's a bit different in the States, I know. The wait time might be 2 or 3 weeks, but the system is very different over here in the UK. So I understand in the States that people have health insurance and there's perhaps a little bit more money to go around the system. In the UK, we don't all carry health insurance. We just all pay into a pot, if you will. So it's universal healthcare. So we have a National Health Service, or NHS, and we all pay for that through taxes. Whether you're rich or poor, you'll pay taxes to pay for that system. And that means that regardless of whether you have cancer or a pre-existing condition, or you break your leg randomly, or whoever you are, doesn't matter who you are, whether you're homeless on the streets or the wealthiest man in the world, you will receive treatment for free on the NHS. So, and that's amazing, and it's an amazing safety blanket, and I don't think anyone in the UK would want to be without the NHS because it is such a great system. Unfortunately, due to the pandemic, due to there not being enough ENT doctors around, the waiting lists are very long at the moment, so I really don't know when this guy is going to be seen, to be honest. So, he may end up having to pay out of pocket to see a private ENT doctor. I think that's probably the best option for him. But in any case, he's come back to me again out of desperation, obviously, because he can't hear. So, and once again, we're suctioning all of this dead skin out of his ear. Now, we are going to go a step further here. At the beginning of the video, you saw me extracting some of the debris with a metal hook. And that's because I'm taking a sample of the debris. And so, in sort of my investigations, I've asked around a few people. And I got a very interesting response from an ear, nose and throat consultant on Reddit. And I said, what do you think about this case? I posted the video. And the doctor basically said that he thinks that this is a sort of mild chronic infection of the skin of the ear canal. And if he were to come across this case, he would basically use a syringe to fill the ear canal with a cream. So, and that cream would contain an antibiotic, a antifungal, and a steroid. So I think he suggested betamethasone, which is a steroid, mupirocin, I think it's called, which is the antibiotic, and then clotrimazole, which is the antifungal. And that ointment cream situation would fill up the ear canal and then stay there. And then he also suggested that this patient would even bearing that in mind, they would still have to come back a few times to have this clearance procedure done. So it's not an easy thing to treat. But that was that person's theory. I think it makes sense. But I wanted to test the theory. So that sample that I took with the metal hook, what I'm going to do is put that under the microscope with a stain to see if there are any white blood cells lurking in this debris. So, and I can't really see any pus, to be honest with you, but at the very least, I'm hoping that I'll see some white blood cells, which would indicate that there's, pus or exudate or something going on. I mean, you would expect that due to the, rapid shedding nature of this problem, this desquamation, this rapid cell turnover, that you'd think that there would be a couple of white blood cells hanging around in the mix, right? I mean, if it is an infection rather than autoimmune, then there must be white blood cells hanging around in the area, releasing growth factor and making these skin cells divide rapidly. So I'm hoping to see a few neutrophils in the sample, but what I'll do is tomorrow or the day after, I'll upload footage from under the microscope with the stain, and we'll have a look at this dead skin, at 100 times and 400 times magnification to see if there are any white blood cells hanging around. But we're down to the eardrum now, so it may not look recognizable, but just to the left of this piece that I'm working on, there's some sort of grey tissue, and that's the eardrum. The eardrum itself has some dead skin on it, as you'd imagine, and the idea here is that we just want to clean as best as possible. So again, it's not recognizable, but the eardrum is now exposed, roughly, and I'm just going to try and get some of this dead skin off the drum. And at this point, the patient is actually fairly is tolerating this quite well, but I just have to go pretty slow and careful here. I'm not going to be able to clean everything, but again, I just want to get it as clear as possible. And it's always a bit risky when you're actually taking debris and dead skin off the drum, because it can be uncomfortable, and again, the risks go up when you're using suction or any type of instrumentation for that matter this close to the eardrum. The risks go up considerably. So that's just something that any practitioner has to weigh up. How far do you take the procedure? How far do you take this? Just trying to grab this skin off the eardrum, and it's to some degree successful. And the bit that I want to clean really is that sort of lower bit there, that sort of yellow splodge right underneath my suction probe. I don't think I managed to get it, but at the very least we clear enough to allow the patient to hear again, which he was very happy with. So it probably would have been a good idea to maybe do 10 or 20 seconds of irrigation to kind of loosen up all this debris and make it a bit more suctionable. But again, I don't really want to it doesn't make that much sense to get the ear wet, really. So there's the eardrum there with the arrow. Not totally clear, but that's where we started. The ear is just chock-a-block, it's full to the brim with dead skin, and there's the after shot. So not a pretty looking eardrum. It's not pretty, but it's functional. So and again, with these type of procedures, as I mentioned before, the risk increases tremendously when you're working off the drum. So we're not looking for perfection, and of course no one's going to give me a trophy for being a hero and stripping it all away despite the risks. So there we go. I hope you found that update interesting, and what I'll do now is I'll go and edit the microscopy video so we can have a look together at what those samples look like under times 100 and times 400 magnification, and see if we can see any white blood cells. So I will see you on the next video.